Now, let's discuss about another type of cancer, which is cervical cancer. And in the cervix, so let's see, this is cervix. So this is a uterus, and this is a cervix. So there's a the vaginal wall. So this vaginal wall has a squamous tissue, which means it's a layer of scale-like cells, while this inside the cervical canal, the surface has an epithelium which is columnar cells. So the problem arises at the junction of this squamo-columnar junction of the cervix, because genetically this part of the cell, one side is squamous, the other side is columnar. So genetically it's not very stable. So that turned out to be the more prevalent site of a cervical cancer arises. So if that we call as a transformation zone. So another example is our esophagus and stomach. So esophageal cells epithelium has a squamous, while stomach epithelium is different. So that junction is also a transformation zone. So this is a good target for us to screen and diagnose the presence of cancer. So in this transformation zone of the cervix, you can see this columnar epithelium in the canal of cervix and squamous epithelium in the vaginal wall at the junction. So that part is squamo-columnar junction is more susceptible in terms of genetic instability. So how do we diagnose this cervical cancer? So we scrape out this part of the junction and we want to look at it. So for that, another way, so we have to watch. So looking through this inside the cervix is we develop a so-called colposcopy. So meaning that this is an endoscope for looking inside this cervix. So, and then scrape out this part and we smear on slide and watch it. So this is abnormal pap smear, and the normal pap smear looks like this. You can see a striking difference because this small dot in the middle is a nucleus. You see the nucleus is rather much bigger compared to the cytosol. So we call it as a nucleus cytosol ratio as one important aspect. And also the shape of this nucleus are different, and so that this and the variation of this nucleus or chromosomes and a lot more mitotic active. So these are cells are kind of proliferating while there are not many here. So all these indications from pathologist point of view can distinguish abnormal pap smear. And this pap smear pap is coming from a doctor name who come up with this method. So Papa Nicolau, or pap smear is called cervical cytology because we are looking at only the cells, not the tissue itself. So cervical cancer screen diagnosis can be done by pap smear or colposcopy. But the definitive one is in fact with this biopsy. Now, next time we will get into the grading of the tumor. So once we find out the tumor, the grading becomes very important because grading makes the stage of the tumor, and that determines our proper treatment.